Causes of delirium in hospitalized older adults. With lack of adequate research on delirium, the exact mechanism of cause within the brain is unknown, but there is speculation that it is related to abnormalities of brain neurotransmitters. Some causes of delirium are due to the direct physiological consequence of a medical condition, intoxication, withdrawal, toxin, or multiple etiologies. Certain medications can play a role in an elderly person's cognition given the right environment and susceptibility. Here are a list of some causes: old age, male gender, underlying cognitive impairment, infection, major surgical procedures, somatic pain, treatment environments, fever, hypoxia, hypoglycemia, electrolyte imbalance, use of drugs such as benzos, narcotics, other medications, central nervous system disorders such as TBI, epilepsy, a history of delirium or stroke, metabolic disorders such as encephalopathy, and general medical conditions such as cardiovascular, renal, and hepatic diseases.
Diagnosing of hospital delirium. Nurses and doctors can use a confusion assessment method called CAM. A CAM assessment is a standardized evidence-based tool that enables a non-psychiatrical trained clinician to identify and recognize delirium quickly and accurately in both clinical and research settings. A CAM includes 4 features found to have the greatest ability to distinguish delirium from other types of cognitive impairment, which includes your Alzheimer's, your dementia, because both of these sometimes get confused with each other if a CAM assessment is not completed at the beginning of a hospital stay. This is the way the CAM assessment is performed. Nurses can keep their eyes on their patients to make sure that there are no changes. The alteration in mental status or the fluctuating course. If this is a yes, then you go down to the second feature. If no, then there's no delirium. You tell the patient to squeeze your hand when they hear the letter A, and you spell out Saveheart, SAVEAHAART, and you can use picture cards. If there's 0 to 2 arrows, there is no delirium. If there's more than 2 arrows, then you go down. Feature 3, alter level of consciousness, no or yes. If it's yes, then you have delirium. If it's no, then you go down to disorganized thoughts. And this is when you ask questions like, will the stone float? Are there fish in the sea? Does 1 pound weigh more than 2 pounds? Can you use a hammer to pound a nail? If the patient can answer the questions with 0 to 1 errors, there's no delirium. More than 1 error, they say it's delirium. There's also a model called Brief Confusion Assessment Model, a BCAM. So providers can use a BCAM as a quick assessment tool because it takes 2 minutes or less to do. It's accurate in identifying delirium, but it's not the best option because it's been known to miss 3 out of 10 patients. This type of assessment is great for the ED, or if a nurse is thinking that the patient's got hospital delirium, this is when they can use this type of assessment before calling a provider in to do a large CAM assessment that takes 10 to 15 minutes.